Hi, in the previous series of the EHR usability tutorials, we covered heuristic evaluation, design, and history. In this section, we'll be talking about the principles or the guidelines for heuristic evaluation. One of the most common guidelines across any of the different variants is a match between the system and the real world. The idea behind this is that whatever is in the mind of your users in terms of the ways they expect things to be phrased or located, it should match what's in their heads. You don't want there to be a disconnect between how the system represents information and what real-world conventions are, in terms of making information appear in a natural and a logical order that fits expectation. Let me give you an example where this fails. Here's an example of a system where when you're walking through the system and trying to search or add a medication, this is the list of drugs that it provides. When you take a look at this and you try to figure out what exactly is the ordering of these medications, it's not alphabetical, it doesn't seem to be based on drug class. You see variations in some that are in all capital letters, some that are in only lowercase letters like that Vicodin at the bottom. Some are broad classes of drugs like antibiotics versus specific types of drugs. You see both brand name and generic. And so this ordering doesn't match the expectation of end users who might at a minimum expect something like alphabetical order, but could expect things to be organized around principles like frequency of use or have some intelligence built into it based on the condition that the patient has or other things that would help guide their expectation for how this list of drugs might be organized. And so this list being so disorganized with multiple formats, with different types of medications and different types of drugs, all represented as a jumble, is an example of a poor match between the system and the end user's expectation for how this would look in the real world. Another example of a design principle, and here in this tutorial I'm only giving you 3 examples, but as you've seen there's anywhere from 10 to 14 typically tested. This one is help users recognize, diagnose, and recover from errors. One of the concerns is that when you have an error message that pops up in a system, those messages should be expressed in plain language that the end user can understand. Many systems have errors that are helpful to the IT staff that you might report the problem to, but don't tell the end user what action is needed or what they should be doing in the moment. So for example, in this system again, you see Mozilla 1.3 beta is not supported. I'll try though, but it might not work. This does not give much information to the end user as to what they should be doing next. Additionally, we've talked about the cognitive burden that EHR systems might place on users, use of icons or things that actually make it harder to do your job. One of the important things in memory demand is trying to help people by having recognition be triggered rather than recall. So it is less difficult to recognize something as being the information that you need rather than having to recall it from memory without support. So the idea here in terms of usability principles would be making objects, actions, and options visible so that the user doesn't have to remember information from one part of a dialog screen to the next. So you want things to be transparent and clear with the options visible rather than requiring that that kind of information be held in the head of a provider or end user who may have multiple demands on them at any given moment. You can think about things like interruptions, and I'll show you an example on the next screen. Instructions for use of the system should also be visible whenever appropriate. So for example, when you're looking at this screen, again, we're struck by all of these icons where when you're looking at them, you have to remember, what does this up, down arrow do? What are all these buttons doing? These vital signs. What patient is this for? There's no indicator of their name. So if you get interrupted between patients or you're interrupted and you have to come back to the screen, do you know who you're looking at or what's going on here? There's a lot of ways in which you could support recognition rather than recall, whereas currently you have to recall what patient you're dealing with, what current date is it, where were you in the system, what do all these icons mean. The Sharp-C project, as part of its efforts, has created a compilation of general design principles and specific guidelines for EHR systems. These are available on our website. As you can see here, these are the 14 design principles that were used and created by Dr. Jiajie Zhang. Each one of these design principles can be accessed on our website. It will be provided with definitions and examples of where this can be used appropriately and inappropriately. And it ties to other types of standards so that you can walk through general design principles to better understand each one. Additionally, we have safety enhanced design briefs on our website that are single page discussions of things like use of color, use of alerts, this kind of information, and they're written in small briefs to allow a broad overview of that topic. All of this information can be found on the sharpc.org website.